With vaccination efforts underway, many are being prioritized who are most at risk for COVID 19, and that includes the millions of Americans who are obese. But as these important efforts are underway, it's important that we not lose sight of treating these underlying conditions that have turned the pandemic into the beast that it has become. So, experts like my next guest are sounding the alarm to not let efforts to get healthy end with a shot in the arm. And with that, we welcome the director of the Barnard Medical Center, the clinic director at the Barnard Medical Center, Dr. Vanita Rahman. Dr. Rahman, thanks so much for joining us here on the exam room.
Thanks for having me, Chuck.
Great to see you again. And let's just start right off at the top. My concern here is that when we talk about getting vaccinated, absolutely very important here, but I don't want for the efforts to stop there. I think that it's important that we do continue to address these underlying conditions because even though a person may be vaccinated against COVID-19, they're not being vaccinated against heart disease, diabetes, so many of these other comorbidities that we could talk about for days here.
Yeah, so a really great point. Let's be very clear here. We know that with COVID-19, not everyone shares the risk equally of complications or death. Those people who are obese or have comorbidities such as diabetes, high blood pressure, their risk of complications, hospitalizations, intensive care, and death are much higher. And while it's very important to vaccinate people, and we believe that vaccines can help greatly, we also want to address those underlying conditions and comorbidities so that people are not at high risk in the first place.
And let's also clear this up. I'm going to ask this kind of from the point of view of a person who used to be overweight, and maybe this would have been my thinking as well. Is that, well, if it's possible to lose weight, and we know that losing weight addresses a lot of these comorbidities for COVID-19 that increase the risk. Well, if a person says, well, I can lose weight, then I may not have to get the vaccine. But what would your response be to that person?
Yeah, well, first of all, it's really important if someone is at a higher weight for them to maintain a healthy weight. That makes a big difference in their overall health long term, but also with COVID-19, it reduces the risk of complications. As far as whether you still need the vaccine, I would still encourage it. We know that in the vaccine trials that were done, the vaccine was 95% effective in preventing infection. So this is a highly effective vaccine. It's been very safe in over 60,000 people that have received it to date, and with minimal side effects. So losing weight, maintaining a healthy weight, very important, but vaccination is still very important to prevent the infection.
And I know that you've put together a presentation, a few slides, a slideshow, as it will, a PowerPoint presentation for those who are watching right now on Facebook and on YouTube. And if you're listening to the podcast on Apple Podcast or Spotify, we'll go ahead and include a link to the video in the episode notes. But Dr. Rahman, if you want to start to bring that up,
Sure.
We can go ahead and walk people through some science.
Yeah, thank you, Chuck. This is really important. So let me share my screen with everyone. And what we're going to talk about is COVID-19 and how comorbidities play a role. So one thing we have known for a long time in medicine and in public health is that diet and lifestyle are key in maintaining a healthy weight, in maintaining a healthy blood pressure, and they also regulate our blood sugar. They impact our cholesterol levels and other chronic lung diseases such as asthma or COPD. And we have known that diet and lifestyle lead to these comorbidities, which in turn increase the risk for heart disease and stroke. Now, heart disease and stroke don't develop overnight. These are conditions that would take decades to manifest. And similarly with high blood pressure or diabetes. But what we are learning now with COVID-19 is that the impact is much more immediate. So if someone does contract COVID-19, the risk of complications and death is much greater if they do have a higher body weight or high blood pressure or diabetes or cholesterol or cardiovascular disease or stroke or asthma or COPD. So let me share some of the research data with you. We know that in the US, before the COVID-19 pandemic started, we had another pandemic of obesity. And over 42% of Americans are obese, and this does not include those who are overweight. And almost 10% are severely obese. This is defined as a BMI of 40 or greater. And I'd like to share with you some research data that came out of a study that was published from Kaiser Permanente in Southern California. And this is a really unique model to study obesity and other risk factors and the mortality from COVID-19. So what the research team did was they looked at the health records of almost 7,000 patients that had been diagnosed with COVID-19 in the spring of 2020. And what they found was the overall mortality rate was 3%. But then they looked at obesity to see how that impacted the mortality rate. And what we see here is the relative risk. That means 3% was the overall risk. But for someone whose BMI was 40 to 45, their risk was 2.68 times greater. So it's 3% times 2.68. And then for someone whose BMI was 45 or more, their risk was over fourfold greater of death from COVID-19. So we see that obesity, especially severe obesity, plays a key role in the risk. Now, one thing we also know about this infection is that males are disproportionately impacted in terms of severity. And what the research team found was that for men with a BMI of 40 to 45, their risk was 4.8 times greater of dying. But then if we look at men between the with a BMI of 45 or greater, their risk is nearly tenfold higher of dying. And we see this in other age groups too. So really, what the study highlights is that obesity plays a key role. And let me also point out that, these rates are adjusted for race, ethnicity, and other comorbidities. So it's really obesity that's driving these rates here. And this is another study that was published about COVID-19 and comorbidities. This came out of Italy, and this was a study of 355 patients who died from COVID-19. And what the research team found was that in those who died, the mean number of comorbidities was 2.7, and only 3 patients did not have any comorbidities of the ones that died. So comorbidities such as diabetes, high blood pressure, cardiovascular disease, chronic lung disease are playing a key role in COVID-related mortality. And this is data from a study that was also published. And what's really interesting here is if we look at people who, almost 300,000 persons who contracted COVID-19 in the US, and if we look at the rates of hospitalizations based on whether individuals had comorbidities or not, we see that of the people that didn't have any comorbidities, the risk of hospitalization was about 7.6%. But in those with comorbidities, it climbs to nearly 45%. And then the risk of death shows similar trends. In those individuals without comorbidities, the risk of death is 1.6%, but it is 19.5% in those with comorbidities. So again, diet, lifestyle, comorbidities all go hand in hand, as does COVID-related mortality. Now, this is another interesting study. This was published from China. And what this research team did was they examined the health records of persons who were hospitalized with COVID-19 infection and who had diabetes. And then they wanted to know if someone's diabetes is well controlled as opposed to poorly controlled, does that impact their mortality? And what they found was that in those individuals with diabetes who had well-controlled diabetes, meaning their blood sugar levels remained below 180, their survival rate was 98.9%. On the other hand, those individuals who had poorly controlled diabetes, meaning their blood sugar levels were frequently above 180, their risk of death climbs to 11%. So, really important that people understand that blood sugar management, controlling diabetes, can greatly impact their complications and survival with COVID-19. And this is where diet and lifestyle play a key role. What we know is that when we eat a low fat plant based diet, we can maintain a healthy weight, we can lower our blood pressure, lower our blood sugar. This is really important when we're talking about COVID-19. We can reduce our cholesterol levels and improve asthma. All of these are the comorbidities that increase the risk for complications with COVID. And why does this work? Why are plant-based diets healthier for us? Well, for one thing, plant foods are loaded with fiber, and we know fiber helps lower our blood sugar, lower our blood pressure, lower our cholesterol. And animal foods have no fiber at all. We also know that plant-based foods have no cholesterol, whereas all animal foods, including seafood, are very high in cholesterol. And plants are naturally low in fat, with some exceptions, whereas animal foods are generally very high in fat. And we know that the amount of fat in our diet impacts weight gain. It also raises our blood sugar levels. It's not the carbs, it's actually the fat in our food. And when we have foods that are high in fiber, low in fat, their caloric density is low. So it's much easier to maintain a healthy weight. The opposite for animal foods, which are high in fat, zero fiber. So the caloric density is very high. And lastly, we know that plants are loaded with antioxidants. These are substances that help our body fight inflammation, infection, whereas animal foods we know contain known carcinogens. So for all these reasons, it's really important that people understand that eating a plant-based diet can help lower the risk of those comorbidities, or if they already have them, improve their control and management. Let me stop sharing my screen.
Well, let's go ahead and kind of use some real life examples based off of what it was that you were just talking about. I'm curious. Like, let's use the old me, version 1.0. When I was 420 pounds, my BMI was 69.9. So you might as well call that a BMI of 70. Based off of the data that you've seen, what we know, what was in your presentation, for somebody who is in that predicament with that high of a BMI, what would the most likely outcome be if they were to test positive for COVID-19?
Yeah, first of all, Chuck, it's amazing that you've been able to transform your health the way you have, and you're just such a great inspiration for all of us. But as far as your question goes, with a BMI of 69.9, that's in the severe obesity category. And at that BMI, someone is not just struggling with obesity, but they're likely to have diabetes or high blood pressure, or they may have already developed cardiovascular disease. And so their risk of complications goes up significantly, as we saw from some of these studies that, the risk is tenfold or sometimes 17-fold with higher BMIs, especially for men. So it's really important to manage a healthy weight. Now, of course, weight loss won't happen overnight, but it's never been more important to eat well and really pay attention to nutrition.
And going back to something that we kind of touched on earlier in the show, is that, again, I can only speak from my own experience being overweight and thinking that everything, I would just grasp at anything for an excuse to continue to eat the way that I was and not have to address the issue. My fear is that people who are overweight and sadly find themselves in that predicament, will think that once they do receive that vaccine, that is then that excuse, that green light to continue those multiple trips a day through the drive-through, eating those 4,000, 5,000, 6,000 calories a day, if not more, just to continue down that road because they're covered for this one thing. And I honestly don't know what it's going to take to change somebody's mentality in that regard, because if they're not ready to change, they're not ready to change. And to me, that's the hardest thing. And I know that you have also lost weight yourself. I would just be curious, not necessarily from your experience as a doctor, but from somebody who's been down that road a little bit themselves. What can you do to change somebody's mentality here?
Yeah, so tough. I think what it really takes is figuring out what's important to us. For me, it really took a health scare for me to realize that I had to change the way I was eating. I had to change my lifestyle in a very fundamental way. And the reason that I wanted to do it is I wanted to be around for my kids. They were really young. I wanted to see them grow up. I wanted to see them graduate high school and go to college and get married and have their own kids. And, my family is really important to me, and I wanted to be around for all of that. So I think what people often have to ask themselves is, why is this important to them? It's not really about the weight. It's not really about the diabetes or blood sugar. We often get focused on the numbers, but what's really behind it? Why is this important to us? And that motivation is what will carry us through.
Yeah, Y is definitely the most important letter in the alphabet. So I'm glad that we addressed the Y today. And then from a physician standpoint, I mean, what can be done to stress this message to patients who are struggling with their weight and might have that mentality? What would you say to somebody who was in your old shoes?
Yeah, I often sit with my patients and I ask them, how do you feel about your health? What are some of your goals and how can I help you? And that really starts the conversation, because I think often people know that maybe things need to change or maybe they're not satisfied with their health, but they just really don't know where to start. They don't know what to believe. There's so much information out there about diet and exercise, and they're truly confused. So, really helping them through the confusion, really help, sharing the science with them in a way that they can understand and in a way that they can implement. There's no point in me putting up a great big study if it's not relevant to them or their situation, but really saying, this is what the science shows, but let's talk about you and why this applies to you and how you can use this information. So, really making it relevant for them is so important.
And last bit of housekeeping here as we wrap this up. In the study, you stated, or one of the studies that you cited, I believe it was the Italian study, showed that only 3 out of hundreds of patients had no comorbidities whatsoever. Nonetheless, I think that even though it's a smaller number, it is important to stress the fact that just because you are a healthy individual does not mean that you are immune from this virus.
Yeah, absolutely. And we've known this with influenza too, Chuck, that every year there are young, seemingly healthy people without any comorbidities that will contract influenza and they do die. And the same is true with COVID. So, no comorbidities doesn't mean no risk of catching the infection or having complications. And that's why we still need to take all the precautions that public health experts have been telling us about: wearing a mask, social distancing. And the vaccine is effective. It seems highly safe. So, if you have the option of getting it, I would strongly urge you to consider that. We have a lot of research data showing its efficacy.
And if we get asked a lot on the show, do you know of anybody who eats a whole food plant-based diet, who is very healthy, who has gotten COVID-19 and became sick? And the answer to that question is yes. And as a matter of fact, a gentleman by the name of Eric O'Gray, another phenomenal weight loss story. Both he and his wife became very sick with COVID-19. Had the opportunity to interview him last year about his experience, and he went into it in great detail. It's a very fascinating interview. So we'll go ahead and link off to that that in the episode notes as well. Dr. Rahman, as we conclude here, any final thoughts that you would like to share?
Yeah, let me also say that we at the Physicians Committee have launched a great new program called Fight COVID-19 with Food. We had two iterations of it last year. We just started a new one a couple of weeks ago. It's a terrific free program, and it's specifically targeting this issue: how to manage comorbidities, how to maintain a healthy weight, using diet and lifestyle, really getting to the heart of the issue so that we can mitigate our risk for COVID complications.
That's so great. And so, I think that it would be so fascinating if you're able to just tell the person, like, look, you may weigh this today, but if you get down to this weight, even if you do become infected, your risk gets so much lower. It drops exponentially. And I think that obviously the way to get to that is with a healthy diet. So therefore, those classes are indeed absolutely critical. And you can check those out. We'll put a link up to that on pcrm.org. So go ahead and keep an eye out for perhaps even a next series of classes. Dr. Vanita Rahman, thank you so very much for your time.
Thanks for having me, Chuck.
If you feel like you've raised your health IQ by a couple of points, go ahead and subscribe to this channel and leave a nice comment below. And to hear the entire interview, head over to Apple Podcast or wherever you get your shows from and subscribe to The Exam Room by the Physicians Committee. And please leave a 5-star rating.